So what do you think that the key features and strengths are for BloodMove?
Well, I think one of the key features is that we've got a network established that involves the BloodMove project team, which is our key clinical staff, which is our nursing and our scientific staff involved, and that also includes our pathology service providers as well. Once we've established those networks, the next key strength of our project is having good communication. We've established that by doing site visits and going out to visit the sites. We've also done education at the sites, but then from visiting the sites and visiting the laboratories, we've started to establish that relationship so that then they feel that they can contact us via email or phone, and then they can also contact the relevant clinical staff as in the nurses and communicate between each other.
In supporting that, just nurturing the links that exist within the hospitals and the supplying transfusion laboratories, and facilitating a communication between those services. Another key feature and strength is the assessing the cold chain of the units of blood when they're sent and stored, so in establishing security of this cold chain. The important parts of this is the transportation of the blood to these sites, and making sure that the shipping system is validated. And what we did within our project is do our own validation and have security that the common routes that are used for this transport of blood is ensured. The other part of cold chain security is knowing that the blood fridges where these units of blood are being stored are compliant to the Australian Code for blood fridges. This did require procurement or purchase of blood fridges at these sites, at sites that were identified that had very old fridges. So the sending laboratory had the security that the blood that was stored at these sites was able to be returned back into inventory when it was returned. Obviously, these sites that were storing it were trained in the appropriate packaging of the blood in the appropriate manner. So when it was received by the laboratory, it was within the temperature range of the blood.
So involved with that was educating, as Rick has alluded to, with staff. And with the education, Rick and I went out and educated staff at the site. We made sure that we educated key staff members at each site, so that if further education was required at those sites down the track, that it would be able to be done to staff members that had missed out. Because as we'd all understand, you can't always capture all staff, especially when we're doing shift work. Another thing that's been the most, I think one of the biggest strengths of the project is the ownership that's taken by each individual that's been involved. A lot of them are donors themselves. They see the product as something that is given that they need to respect, and they want to ensure that they're involved in the process of reducing the wastage, and that it is actually issued to patients and used in an appropriate and safe manner.
So what we've been able to do as part of the BloodMove project is foster an understanding by the to the pathology providers and also the hospital staff that store the blood, foster an understanding that we try to not waste this product. So what we now have with this success of this project of minimising wastage is an understanding by these stakeholders that they actually get happy. They're excited when the figures come through every month, and we realise that the wastage is actually going down in real terms. And what we believe has happened is that we've ingrained in a stewardshipness by these individuals of the units of blood. So what previously was accepted as unavoidable waste now is regarded as avoidable waste.
And they actually want to get down to 0%. They actually want to get down to where there's no wastage of blood products.